Congresswoman Speier, thank you so much for your leadership on this. And I'm glad to join you in the effort. I'm a newcomer to the effort. It was a couple months ago when a doctor from the Chicago area who was part of the National Poison Control Center alerted me to this. And when I heard about it, I thought, well, that is so obvious. How many things do we have in our home that have child-proof caps on them to protect the kids from their curiosity? And when it came to this product, to think that 17,000 kids had a bad event with one of these packets, and 700 plus ended up in the hospital as a result of it, and one, sadly, in Florida, lost its life over these packets, brought it to my attention in a hurry. And I started looking around and looking at the packaging and thinking, you know, we can do better. So here's what we've done. We've written to the government agency, the Consumer Product Safety Commission, and asked them to help us lead the way. The problem with that is the government moves slowly. And while the government is moving slowly, if it does move in the right direction, kids are at risk. So my basic plea is to the industry, starting with Procter & Gamble. This is your product. You tell the people who are about to buy it, you are friends of American families. Well, show it. Put some basic protection in the package. Make it a little tougher for the kids to get into the package, but easy for adults. Do something about this packaging too. As Jackie showed you, when you look at these things, you think, how would a kid know, a little kid, know the difference between something that is toxic and something that's sweet until they bite into it? And that may be part of it as well. What's inside the package, as the Congresswoman said, is something they ought to look at, what this chemical is included here, and maybe this little package itself. If it had a bitter taste to it, the kid might spit it out right off the bat, and that'd be a great start. As far as warning labels, I'm all for them. Make sure that every parent and grandparent, we do some babysitting, every grandparent knows this is a dangerous product to have out and about around kids. What I'm basically saying is Consumer Product Safety Commission is a great group. I support them, fight for their funding, but to the industry, don't wait. Do it yourself, and do it in a hurry, because kids' lives are at risk here. We're going to have a word here from Dr. Kieran McGrath, who's going to speak to us, Kieran Quinlan. I knew a Kieran McGrath, these Irish names in St. Patrick's weekend. Kieran Quinlan is going to speak to us from Chicago. I'm glad you're here, but before you get your moment, I'm going to ask my colleague, Senator Bill Nelson, to step up.
Thank you, Senator Durbin, Senator Nelson, and Congresswoman Speier for taking on this important issue and for asking me to speak today. My name, as we said, is Jill Koziel, and I'm here today as many things: as a mother, as a businesswoman myself, an inventor, a constituent, and now a consumer advocate. I'm a mother of two beautiful, smart, and precocious daughters. The eldest, Claire, is 3 years old, and Kate is now 15 months old. I'm also a businesswoman and an inventor, and as such, I respect the innovation involved in developing these liquid detergent packets. I'm also a constituent and consumer advocate because of my personal experience as the mother of a child who suffered after ingesting one of these liquid detergent packets. This past September, when Kate was not quite 9 months old, my husband and I experienced the worst thing imaginable as a parent, rushing her to the pediatric emergency room to be intubated before our eyes after biting into a detergent packet. Our family had recently moved to New York City, and our apartment's laundry facilities were on a different floor, making these detergent packets a very convenient product. I'd set a packet on top of our very tall laundry hamper in preparation for my husband to take the laundry down when he arrived in the coming minutes. I turned to help my then 2-year-old clean up some toys, and my newly mobile 8-month-old managed to quickly crawl to the hamper, pulled herself to standing, and bit into one of the packets that we just threw back there to you guys. I hope it didn't explode. I've always heard that life happens in a split second, and for me it really did that day. I heard Kate gag, and I turned to see the packet drop from her mouth. I grabbed her and began rinsing her mouth out with water, and then I quickly ran to the closet up high where I stored the actual box that the detergent pods were in to read the safety instructions. While continuing to rinse out her mouth, I called New York Poison Control, which I had thankfully previously programmed into my phone on speed dial. To my dismay, Poison Control was not equipped to address this issue and treated it like any laundry detergent, recommending that I monitor at home and only call 911 if she started to vomit, purely because of the risk of aspiration because of a child her age. Thankfully, Kate began vomiting and I called 911. One of the benefits of being in Manhattan is that within 20 minutes of Kate biting into the detergent packet, she was being evaluated at the pediatric ER. However, again, the doctors and nurses were trained to treat our situation as they would any detergent poisoning, recommending a wait-and-see approach. We were relieved. My husband went home with my 2-year-old at the time, to put her to bed and to calm her. This is the moment that a consumer advocate in me was born. I take ownership and responsibility as a mother, and I will always second-guess that moment of leaving that detergent packet anywhere within reach. That said, consumers, medical personnel, and the media have been led to believe that these detergent packets are just like normal detergent. Advertisements warn, like other detergents, keep away from children. These packets are not like other detergent. The innovation requires that they be specifically more concentrated and explode. A mere hour after her father and sister went home, relieved that a crisis had been averted and that Kate was safe, she was intubated before my eyes in a very frantic ER for airway protection before being transferred to a pediatric intensive care unit uptown. Kate had started to exhibit breathing distress with wheezing, stridor breaths, gagging, and drooling. For the next 2 days, she remained under medically induced twilight anesthesia before a GI scope thankfully revealed no damage to her esophagus. Kate was lucky, very lucky and blessed. Many other children, over 10,000 per year, have not been so lucky, suffering from esophageal burns, scar tissue, airway challenges, eyesight issues, and more. These laundry packets, as convenient and as innovative as they are not like other detergents. And as such, consumers must be properly educated and, in this case, protected. I've been working with the Consumer Product Safety Commission, ASTM, and the liquid detergent packet manufacturers to address these issues. And sadly, despite what I believe to be good intentions, progress is slow and undefined. And so this bill is necessary, an important step to protect our children. Specifically, and most important based in my experience, it requires the design of the packages to reduce the likelihood of exposure to detergent. My hope is that the design changes selected by manufacturers will be to individually wrap each packet, similar to other powder detergent packets. And in closing, I'm here today as a mother, as an inventor, and now a consumer advocate to plead to every member of Congress to come on board to sign the Detergent Poisoning and Child Safety Act of 2015 into law. I believe this is truly a nonpartisan issue, and I ask that every constituent with small children in their lives learning about this today call on their elected representatives to support this bill. Thank you.
Good morning, everyone. Senator Durbin, Congresswoman Speier, Senator Nelson, ladies and gentlemen. I'm Kyron Quinlan. I'm a pediatrician in Chicago, and I'm here today representing the American Academy of Pediatrics, and we really support the Detergent PACS Act. I am a pediatrician, as I mentioned. I currently serve as the chair of the American Academy of Pediatrics Council on Injury, Violence, and Poison Prevention, as well as an associate professor of pediatrics and preventive medicine at the Rush University Medical Center in Chicago. The American Academy of Pediatrics represents 62,000 pediatricians around the country, and we're very grateful to have the chance to join you today. The AAP supports the Detergent PACS Act and applauds Senator Durbin, Senator Nelson, and Congresswoman Speier for introducing it. I do want to refer to some research that was published in the journal Pediatrics in 2014, done at Nationwide Children's Hospital in Columbus by Dr. Gary Smith, which found that after these packets were introduced into the marketplace, approximately 17,000, a little over 17,000 kids had their contact with this product have to get reported to the National Poison Data System. So over 17,000 kids were affected by this product and needed to enter the poison system. These were kids that were young kids. They're typically under the age of 6. This is 17,000 kids in just 2 years of time, just in 2012 and 2013. Specifically, this study found that as soon as these products hit the market, child poisonings from them shot up. And right now, just under 1,000 children every month are poisoned by these. Children younger than 3 years of age make up the bulk of the cases, approximately 73% of the cases. And actually that makes sense. As most people know, 1 and 2-year-olds are able to get around pretty good. They can climb, they're very good with their hands, and they typically put a lot of stuff in their mouth. actually a friend of mine, a pediatrician friend of mine, told me that they went to the grocery store and her 3-year-old stopped in the aisle right where these pods were being sold. He stopped and he looked over at them and said, "Candy." These are very attractive. But from the published research, we know that most of the time, children try to eat or swallow these. That's the main way they get exposed to these. They sometimes burst open and are affecting the child's mouths, their stomach, the gastrointestinal tract, skin, and even their eyes. Many children do become quite sick, some with very serious trouble breathing, just like Kate, and some with seizures, some losing consciousness. These are not mild exposures frequently. There are 100 children that had to be intubated, just like Kate. This is where a tube is placed into the windpipe of the child. It's usually done when it's a very serious exposure and there's concern for the possibility that the airway to close and threaten the life of the child. Over 400 children needed to be put in intensive care units, just like Kate. Many of these children experience vomiting, coughing, choking. A number of children experience burns in their mouth or the gastrointestinal tract. And sometimes this detergent got into the eyes of the child and threatened the sight of the child. These can be very serious ocular burns. And most tragic of all, of course, is there was a 7-month-old who did die because of this ingestion. So you may ask, why are these any different than the usual laundry detergent? Why is this a special thing? These relatively new products have more severe reactions than traditional liquid detergent. And exactly why is not known. More research is needed into whether the packet's composition may be able to be changed so that it is less harmful to kids. So these statistics are alarming and have rightfully moved parents, pediatricians, and elected officials into action. We must work together to protect young children from the dangers of these common household products. To start, we should require child-resistant packaging, better labeling, and changing the product ingredients to make laundry detergent pods less toxic to children like Kate. The AAP therefore commends Congresswoman Speier, Senator Durbin, and Senator Nelson for introducing the Detergent PACS Act, which would require the U.S. Consumer Product Safety Commission to create a mandatory standard to make these packets child-resistant, like many other hazardous cleaning materials in the home. The bill would also require CPSC to ensure that the packets are less attractive and less likely to cause harm. The bill would require warning labels on the products so parents can understand the unique danger that they pose. So thank you to Senator Durbin, Congresswoman Speier, Senator Nelson, for your leadership on this issue and all you do for children. The AAP looks forward to working with you to advance this important legislation.